Maayong hapon sa atong mga pinalangga ug binating kaigsuonang Subuanon. Maayong hapon usab sa tanan nga nagtan-aw karon gikan sa ubang mga probinsya sa Kabisayan, Mindanao ug sa Luzon ug sa uban pang mga nasod. Aniya ako alang sa paghatag og report kabahin sa probinsya sa Subo. Nga sa milabay nga duha ka adlaw mao'y gi-headline sa among local newspapers. But we will get to that. First, let me give you an update of the actual COVID situation in the province of Cebu. Our figures are validated, confirmed, and based on real time. And so there is no room for duplication and there is no room for false data because each and every one of these cases have actually been verified down to barangay, municipality, and city levels. And so, as of August 23, 2021, there are 29,197 cases carried over from last year until now. Of the 29,197 cases, 4,774 are active cases or 16.4%. 22,799 or 78.1% have recovered with 326 new recoveries. 1,624 have died, listed as COVID deaths. But as I have always said, we verify down to each and every death certificate. And this is the distribution of the 1,624 deaths. COVID deaths per se were 398. Other diagnosis, meaning incidental, COVID incidental, they died of other causes, but when swab turned out positive, numbered 711. Pending diagnosis, 515. Therefore, if we are to truly consider the actual COVID deaths, not including those that died of hypertension, those that died of diabetes, sepsis, pulmonary tuberculosis, stroke or aneurysm, cancer, or even motor vehicular accident, which are also included in this 1,624. If we actually just consider those that died of COVID per se, without any other cause, the 328 corresponds to 1.4% mortality rate. These are the other causes of death. As I had already mentioned, heart problems, community-acquired pneumonia, kidney disease, stroke or aneurysm, septic shock, cancer, multiple organ failure, diabetic ketoacidosis, and brain trauma due to motor vehicular accident. 6 of these credited to the part of the 1,624. Is that with Cathy? Well, we can post this on Subo News. Now, of the 4,774 active cases, those that are in isolation number 3,662. Home isolated is 2,980. Facility isolated is 682. The 3,662 in isolation whether at home or in a facility, corresponds to 76.7% of our 4,774 active cases. The 3,662 are distributed as follows. Symptomatics, 3,154, classified as mild. Asymptomatics, 508. Those that are hospitalized are 1,112. Of the 1,112, 449 are mild, 538 are moderate, 36 are severe, and 89 are hospitalized due to hospital protocol. What does this mean? They went to the hospital for other causes. They were either there to give birth, they were there for an operation, they were there for an accident, but since hospital protocol demands that they be swabbed, they are numbered amongst those that are hospitalized, numbered as a COVID case. This is to just give clarity to the numbers. Now, what is the COVID-19 hospital bed occupancy as of August 23, 2021? We have 495 beds corresponding to our 4 provincial hospitals and 12 district hospitals. We are not counting the private hospitals that are also in the province of Cebu. This only refers to the 495 beds in our own provincial and district hospitals. Occupancy right now is 242 are occupied, which corresponds to 49%. Available beds is 253 or 51%. As I said, for the past 2 days, the province has been the target of headlines of our local newspapers. Yesterday, Sunstar states, Cebu province hits 6,000 active cases. I believe this was based on the DOH figures dated Sunday or August 22. Let's put this in proper context. You must remember, the province of Cebu has a population of 3,200,000. When you say that the province has 6,000 active cases, certainly you cannot compare that and put the province in the same context as a city of 1 million population or 600,000 population. And so, as what is always done in the medical context of ascertaining the seriousness of any disease, we must consider the incidence in relation to the population. So let me present to you the incidence, meaning how many cases per 100,000, and how does the province of Cebu compare with the other cities and provinces of the entire country. This is data gleaned from the DOH. These are not our figures, these are figures from the Department of Health as of August 24, 2021. We have the ranking. Apayao, with a population of 119,184. With a population of 119,184 and 731 active cases, ranks number 1 at 613 active cases per 100,000. Mandaue City, with a population of 362,654 and 2,005 active cases, ranks number 2 at 553 per 100,000. Pateros is next with a population of 63,840 and 350 active cases, ranks number 3 at 548 per 100,000. Cebu City, with active cases of 4,588 and a population of a little less than a million, or 922,611, ranks number 4 with 497 active cases per 100,000. Next is the city of San Juan, population of 122,886, 593 active cases. That gives you 483 cases per 100,000. Next is the city of Makati with 2,775 active cases. It has a population of 582,602. That gives you 476 cases per 100,000. Number 7 is Lapu-Lapu City. Number 8 is Pasay City. Number 9 is the city of Pasig. Number 10 is the city of Muntinlupa. Number 11 is the city of Parañaque. Next is the city of Navotas. Number 13 is the city of Las Piñas. Number 14 is Taguig City. Number 15 is the city of Malabon. So on and so forth. This is followed by Ilocos Norte, population of 593,000, 1,734 active cases, or an incidence of 292 per 100,000. This is followed by Cavite, the city of Mandaluyong. Number 19 is Cebu Island. What is Cebu Island? That is composed of the tri-cities of Cebu City, Lapu-Lapu City, and Mandaue City, and the province of Cebu, which is composed of 44 municipalities and 6 component cities. Cebu Island, with a total population of 4,919,667 and 13,862 active cases as of August 24, 2021, according to the DOH, ranks number 19 with 282 active cases or incidents, 282 cases per 100,000. This is followed by Bataan, and then Cagayan, then the city of Pasig, the city of Valenzuela, Laguna, the city of Manila, Bulacan, Quezon City, Caloocan, Iloilo City, Baguio City, Dagupan, Angeles City. Rank number 33 is Cebu Province. Why are we number 33? In spite of the screaming headlines that the province hits 6,000 active cases, which, by the way, according to DOH, as of August 24, is 5,545. To put it in proper context, we have a population of 3,276,437, and therefore an incidence of 169 per 100,000. Bohol ranks number 40. Negros Oriental is number 73. And Siquijor is number 114. So, I wish that the next time headlines choose to scream numbers, they would put it in proper context. Because what else would you want to achieve? by these glaring headlines. A total lockdown? Well, even the DOH has already said that prolonged lockdowns don't work. We just need to find that proper balance. And if we are to put it in proper context, Cebu province certainly does not rank as among the top 10 with highest incidence per 100,000. To think that with a population of 3,200,000, with 44 municipalities and 6 component cities, Cebu province ranks number 33 with an incidence of 169 per 100,000 compared to the number 1 ranking province of Apayao, which has an incidence of 613 cases per 100,000. That is, I believe, the proper, fair, just, and equitable way of looking at figures and analyzing figures. Today's headline in the Freeman states that Cebu province has the most deaths. Again, without putting into proper context exactly how does the number relate to the population. Remember, while other cities have populations of 600,000 or 900,000, the province has thrice that number at 3,200,000. And so we once again, using DOH figures from the Department of Health as of August 24, 2021, we ranked the provinces and cities in accordance with the incidence, meaning the number of cases per 100,000, because that really is the proper way to go. Mortality man na. Ano nga rin? That is how cases have always been determined. Severity of a disease has always been determined since time immemorial in the medical field. The seriousness of a disease is always determined in accordance with incidence to population. And so, what is the ranking here? In the top ranked provinces and cities, the city of San Juan, with total deaths at 205 and a population of 122,886, ranks number 1. What is the mortality per 100,000? It's 166.8. How do you get this? Total deaths divided by population. Cebu City ranks next with total deaths at 1,123 and a population of 922,611. That gives you a mortality rate per 100,000 of 121.7. The city of Pasig ranks number 3. 785 total deaths vis-a-vis a population of 755,300 or 103.9 deaths per 100,000. This is followed by Baguio City, the city of Makati, Mandaue City at number 6, the city of Valenzuela, city of Santiago, Iloilo City, City of Mandaluyong, Pasay City, City of Manila, City of Malabon, Marikina, then Lapu-Lapu City, with deaths at 296 and a population of 408. That gives you a mortality rate of 72.5 per 100,000. Followed by Navotas, Pateros, the entire Cebu Island, with total deaths at 3,094 and a total population of 4,919,667, gives you a mortality rate of 62.9 per 100,000. Next is Bacolod, Benguet, Quezon City, Olongapo, Caloocan, Davao City, Mountain Province, Bataan, and Cebu. Per POH data of 1,624. PHO data of 1,624. Remember, this also includes those that died of diabetes, heart disease, brain trauma caused by motor vehicular accidents, sepsis, community-acquired pneumonia, and others. We took the whole number of 1,624. This ranks Cebu at number 27, with deaths at 49.6 per 100,000 in a population of 3,276,437. However, if we were to focus on our data with the incidental findings at 711, meaning these deaths were COVID incidental. They died. The primary cause of death is other cause, and except COVID, but when swabbed, they were found to be COVID positive. This is 711, as I previously presented to you. In the province of Cebu, at 711 deaths, that's 21.7 deaths per 100,000. But if we were really to focus on the pure COVID deaths, as I previously also presented to you, based on the death certificate as the immediate cause of death, COVID, this is 398 deaths. In a population of 3.2 million, that would give you a 12.1 death per 100,000. To give you a sense of scale and proportion. But yet, if you read this, Cebu province has most deaths, you'd think that everyone is already dying in the province of Cebu. If anyone has any sense of fairness, especially in journalism, which actually, especially when reflected in screaming headlines, has so much effect on the public, then I just hope that next time the writers would acquire a sense of fairness, a sense of scale, and a sense of proportion. We have all of this data. You may validate it. You may confirm it yourself. And all of these data are available. A simple confirmation with the province might perhaps have enlightened, might perhaps have educated the writers further. So that is my answer to these 2 days of incessant, misplaced focus on just figures alone as far as the province is concerned. And now, I am aware that there are those that keep on just attacking our stand on tuob. Oh, no, not tuob, because people get, ballistic. Steam inhalation and the air purifier, forgetting the fact that we have long advocated a two-pronged approach. For those that are truthful enough, stop peddling half-truths and blatant lies. We have advocated a two-pronged approach. One is the use of science and technology, and therefore we are pushing for the use of air purifiers with HEPA filters and personal air purifiers as an added defense on top of all the masks that you want to wear and all the face shields, which we have been doing for a year and a half. Surely, we continue to have these cases. If this alone could give an additional 10%, why don't we use that to help ourselves? But you see, I have not only been talking about tuob and air purifiers, Ms. Ruby Pansoy. You think that was all I've been advocating? When we talked about boosting the immune system, and it's part of all my EOs, even from as far back as EO 20 and 20-A dated last year, when we reopened tourism, subject to very strict protocols. We included in there the health regimen. Health regimen meaning give your body. Your body has that first line of defense. Boost your immune system in order to protect yourself from COVID-19 or any other disease for that matter. And that is why, since the beginning of this year, we have been distributing vitamins to all of our frontliners, to over 55,000 barangay health workers, barangay tanods, daycare workers, barangay nutrition scholars, all of our barangay officials, our traffic enforcers, our emergency responders, and all that are actually out there in the front lines, including the PNP. Well, this morning, we started distributing to all of our drivers and conductors of all of our public transports, buses, minibuses, this vitamin pack for free. This is 1 month supply, 30 capsules of vitamin C with zinc, 30 tablets of vitamin B complex, and 30 capsules of calcium with vitamin D3. We have started distributing to all of our drivers and conductors who are now wearing air purifiers. As an incentive for them to continue wearing these air purifiers, we are giving these vitamin packs for free. In the same way that we are also distributing these to all of our frontliners for free. For the general public, we will be subsidizing this vitamin pack. Again, with vitamin C plus zinc, vitamin B complex, and calcium with D3. We are very transparent. The actual cost of this is 192.30, 1 month supply. We are subsidizing almost 11% of that. So from 192.30, the public can buy this at 172.50 for 1 month's supply of vitamins. Even as we continue to advocate healthful living, as we encourage people to exercise, to go out and smell fresh mountain air and fresh sea air, to go to the sea, because saline is good for you. Even as we continue to advocate healthful eating through our Sugbusog program, asking our households, puroks, barangays, and local government units to plant vegetables for home consumption or for additional income once the harvest goes beyond the household need. So this is what we are doing in the province of Cebu. I thought that I would take this opportunity to go live because half-truths or blatant lies that are peddled incessantly soon get to be accepted as truths. Was it Goebbels who said, repeat a lie incessantly and soon people will believe you? Well, I would like to think that the Cebuanos are better than that. That they are not as gullible as some people would want them to be. Mga pinalangga, ubinati kong mga Cebuanon, ilabi na sa probinsya sa Subo, kalauman ninyo nga nagpadayon ta, bisan pa man sa tanang pag-uyog, tanang mga unos nga akong giatubang. Magpadayon ako, pag-alagad kaninyo kay inyo man kong gipili. Inyo ma akong gisangunan ni ining dakong responsibilidad nga magtan-aw kung unsaon nato pag-atubang kining dakong hagit karon. Dili lamang ang probinsya ang nagatubang, kung dili ang uban usab nga mga syudad, ang ubang mga probinsya, gani ang tibuok kalibutan. Sa sunod nga higayon nga magpakita ta unta og mga figuras maayo tingali unta nga ato sad hinumduman kung unsa og pila kadaghan ang probinsya sa Sugbo. Put it scale and proportion. That is the fair, just, and equitable way to go. And that is the Cebuano way. Dinhin na lang kutob. Salamat sa inyong pagpaminaw. Dunay mga pangutana.
Hi, Gov. Good afternoon. I'm just Gov from TV5. Clarification lang, Gov. So, if tuloy po ngayong araw yung start ng implementation natin, no?
Bukas. I believe the memo was suspended until August 25th. So by tomorrow, that is when the drivers will be checked whether they are wearing air purifiers. But we advanced the vitamins today, and I think most of them are already wearing air purifiers.
Clarification lang, Gov. Mayroon ba tayong standard kung anong klase ng air purifier yung gagamitin? Kasi yung iba, Gov, hindi nila alam kung tama ba yung nabili nila. Meron daw silang nabili at 400.
I encouraged all of because it's really the operators that bought these air purifiers, and I encourage them to see to it that they will buy from suppliers that carry warranty on the purifier itself and to test it, because I would not also go so far as to dictate them on what brand to purchase. That's for them. It's always a matter of choosing what is a good quality air purifier.
Okay. No more? No more question? O sige. You can address your questions after the live. Wala na sila yung question ko. Punya na lang after sa live. So in closing,
Yes, Dale.
Vitamins go.
Yeah.
Good for 30 days na sila for all the PUV drivers.
Yes.
Regardless
For all of, right now we are distributing in the north and south bus terminals for all of the public transport drivers that are using our terminals. However, we also met a few days ago with the operators of the modern jeepneys, and we are taking down the names because we are also including them. since they are also frontliners. I had asked these modern jeepneys that are largely air-conditioned to please open up for ventilation, and they are willing to let their drivers, wear these air purifiers. So we will also be distributing to the modern jeepneys.
So regardless if they wear the air purifier, they'll be given the vitamins.
No, this is the incentive. That is why
Okay.
earlier, I think they were already, because they thought today would be the implementation, all of them were wearing already. So we are incentivizing it. This is the good way to incentivize, not to offer huge sums para i-declare nga COVID so that you will have big collection. As I've been saying again and again, boost your immune system. Well, I think this is the first province that's putting its money where its mouth is by distributing free vitamins and subsidized vitamins. So, Ms. Pansoy, it's subsidized. And I am not only focused on air purifiers and tuob. Dili tuob. Steam inhalation.
Included man ang conductors na aside sa driver?
Yes, including the conductors. Now, every bus has at least 2 drivers because they're on shift and 2 conductors. So, we are including the conductors because they're also always on the bus. They are just as exposed.
Okay, no more? Nakalak ng question? Okay, go. Closing?
Well, in closing, I think I've closed it already. Ganina, usbon na lang ni nako nga sama sa giingon ko bisag unsa pay akong atubangon ug giatubang. Kamo gihapon mga Subuanon, mao'y akong prioridad. Ug paningkamutan nako ang tanan kutob sa akong maabot. Kutob sa akong mahuna-hunaan, kutob sa akong mahimo. Nga labaw sa tanan ang inyong kaayuhan. Mao'y mo patigbabaw. Gikinahanglan ta magbalanse. Balansehon nato. Dunay hagit niining nagasaka nga mga kaso sa COVID-19 apan mismo ang Department of Health ug ang WHO na ang niingon dili usab solusyon ang pag-lockdown kay mas daghan pa hinuon ang maglisod. Kung mga undang ang trabaho, panginabuhi, mas daghan pa ang mga sakit. Kay wa na'y klarong gikaon. Busa balansihon tani. Hangyoon ako matag usa kaninyo, mga pinalangga na kong Subuanon. At timana ang inyong kaugalingon. Ayaw mo pagpabaya ug ayaw mo pagpasaya. Take care of yourselves. Gibalik-balik na nato. Liguna ang inyong resistensya. Daghan kayong paagi. O gibalik-balik tanan na. Kaya ra gyud. Dili kinahanglan nga mugastog dako. Mananom tag mga utanon, limonsito, mo inumta og duwaw, butangag limonsito, vitamin C na, magpainit ta, vitamin D na, o gusto gyud mo vitamins, gi-subsidize na ni nato. Available ni sa mga lungsod ato ning giapod-apod. Subsidized ni sa province of Cebu. Bali ni usa ka buwan. Apan ang tanan nato ng mga frontliners libre. Lakip na karon ang atong mga drivers ug konduktor. Daghan kaayong salamat ug sa kanunay hinumdumi. Mga Subuanon, kaya ni nato. Ipakita nato nga bisan pa ug unsay atong giatubang magmalampuson ra gihapon kay kita mga Subuanon. Daghang salamat, maayong hapon.